So guys, we're having this problem again. Since we're just a few, I'm going to finish with you guys. Okay, we're going to have our 15 minutes, and then we're done. Okay, so the next one would be Danitza Burgoa.
Yes.
Hey Danitza, how are you doing?
I am doing fine, thanks.
Okay, so you have your 15 minutes. So tell me a little bit. I know that you are already an advanced student in medicine. So you're going to tell me a lot of things about CBC. Okay. Tell me everything you actually might not more of.
Like the concept and
Yeah.
okay. Okay. Well, the CBC, the complete blood count, it's a medical procedure that involves testing a sample of blood and to measure the numbers, the red blood cells, white blood cell platelets, and also measure uh, um, the blood chemistry.
Okay. Let's focus on just CBC. Okay. First.
Oh yes, yes.
Okay.
And it can help us to diagnose a lot of diseases.
Okay. Okay. Great.
And
Okay. So. You already know about the red blood cells and what it helps us for, and let's talk about white blood cells. So um, you already know about the three main types of white blood cells that have different shapes in their nucleus, right? What are those? Neutrophils. What are the other two?
lymphocytes and monocytes.
Okay, it would be lymphocytes and monocytes, right? They're actually known
Lymphocytes.
as
Mono. Okay.
mononuclear cells, right? However, we have another group of white blood cells, which are uh, I'm going to say it in Spanish for you to get it. Polimorphonucleares. What are those? The three main cells of polymorphonucleares.
Um. Well, I don't know how to say it in English. No, bueno, neutrófilos, eosinófilos y
Okay.
basófilos.
Okay. So we be
Um,
neutrophiles, right? Neutrophils, eosinophiles,
Neutrophils,
eosinophiles,
eosinophiles.
and basophiles. Okay. So,
Okay.
what are those three cells related to specific conditions? For example, neutrophils are related to when their count is high. What would you think of?
I will think in the first thing, an infection.
Great.
Um, infection, I'm sorry, are maybe mm,
What kind
we
of
can
infections?
um, bacterial
Okay,
infections.
great. Yes.
Uh,
Okay. And what about the other two?
in the eosin eosinophiles.
Yes, great, correct.
Um, uh, as I remember, the I'm sorry, the increase in this type of cells. What I don't know how to call it. Eosinophilia.
Okay. Yes.
Um, it's come. The levels are increased when we have a parasite infection.
Okay. Parasites
Also,
infection. Great. Any other condition besides parasites?
asthma,
Okay. Yes.
mm, some type of cancer, leukemia. No, no, yes.
Have you ever
Mm,
heard about dress syndrome?
no.
Okay, you're going to read it. Okay. It's I actually, when I was in infectious disease rotation last year at my hospital when I was a resident, I saw two cases of dress syndrome related to tuberculosis treatment. It was quite interesting. If you read it, you're going to find it interesting as well. Okay, so the increased number of eosinophils is mainly related to parasites infection, right? And could also be related to dress syndrome. Okay, and what about the last one?
Basophilia,
Okay,
maybe some allergies.
great, awesome.
In,
And what about lymphocytes? What would be uh, causes
so
of increased lymphocyte count?
mm, we can find lymphocytosis, um, and viral infections, also bacterial infections like tuberculosis.
Right there,
Um,
not only tuberculosis. You know that this bacteria is actually an intracellular bacteria, right? Tuberculosis. That is why the treatment is really in a long term, right? So this is why
yes,
it's an intracellular bacteria. Could you give me an example of any other intracellular bacteria that might be related to lymphocytic increase count?
another
Intra, yep.
um, the Brucella rickets. I think it was in this lymphocytosis and um and
Brucella, Francinella,
brucellosis.
right? Yes,
Um,
yes, you're right. Brucella,
rickets.
Francinella also, right? Neisseria is also. So yeah, you're right. You get a basic knowledge. Okay, so what about blood chemistry? You were starting to tell me a little bit about blood chemistry.
Yes. we the param parameters
Yes.
I don't remember how to say glycemia,
Glycemia.
glycemia. Okay. Also creatinine,
Okay.
urea, uric acid, and the electrolytos.
Okay.
I'm not sure.
Electrolytes. Electrolytes.
Electrolytes.
Okay.
Okay.
Okay. What else?
Um, bilirubin. Oh, is that correct?
Sorry, I didn't.
Bilirubin.
Bilirubin.
Bilirubin. Okay.
Okay. Great.
Yes.
So,
Um.
since I know that you are an advanced student, as I told you, would you tell me the cause of kidney failure in a patient who has been involved in, let's say, a breakdown in his or her house, like falling down a house?
Um. I'm sorry. Can you repeat
Yes, sure.
that again, please?
Okay, no problem. So let's say you have a patient, you're at the emergency department. Let's say you're on your shift and you get a patient who just, here in La Paz, well, it happens a lot. You know that there are a lot of rivers under our city, under my city, which is La Paz, okay? So most constructions, most building houses, a lot of buildings, like its walls get really moistury, okay, and they tend to fall down, right? And do you get it?
Yes.
Okay, so you have a patient, you are on your shift at the emergency department, and the let's say policeman that brought your patient told you that this patient was sleeping in his house and his whole house came down. What would be the explanation for this patient to develop acute kidney injury?
Um. Well, yeah. Okay. Well, for the um, it it is caused by the trauma that he has,
Okay.
and we can find um maybe in um, uh, the explanation you say,
Yes.
right?
Why would a patient like this would develop acute kidney injury?
Mm,
You know, there are some
I see.
types of molecules that could damage mainly the tubule parts of the nephron, right? One of them
Yes.
is,
Oh, yes.
yes, yeah, you can
Yes.
go on.
I think um when okay, I had this patient and I could ask for um an examen de orina. I I don't know how to say. You
Okay.
sometimes no, yesterday you said that I don't know how to say it in English.
Okay.
Urinalysis,
Yes, great.
something like that. And well, and a part of this exam, there's the um, urinary sediment or
Yeah, could be. Yeah.
something like that. Um, and you talked about cylinders or
Yes.
and well, I remember that the Tom Horsfall protein
Yeah.
it was um, that is a protein that is produced by the renal tubular epithelium, if I
Of the
guess.
hand loop.
Look up panel.
Yeah. Great. So in a urinalysis and the urinary sediment, we would find um, some cylinders, right? In a patient like
Yes,
this, and this patient would develop kidney failure or kidney injury, acute kidney injury, because as you said, might have had some trauma, right, during his
trauma. Oh,
during his house falling down, right, and this could cause the liberation of myoglobin from the muscles, which are they when a house is coming down, right? It could cause a lot of
yes,
trauma, right? And when they hit the muscles, they get destroyed. And not really destroyed, but they get really harmed, and they release this protein, which is myoglobin. Myoglobin actually gets to the kidney and causes an obstruction inside the tubules, and it causes acute kidney injury. Okay.
oh yes.
Okay. So, Danita, we're done with your 15 minutes, and we are having this issue with the account. So I'll see you at the end of the class. There's one more person left. Okay.
Okay,
Okay. Thank you. See you later.
thank you. See you later.
Brisa Montoya, are you here? Hey, Brisa.
Hey, good night.
Hey, how are you doing? So, we from now on we have your 15 minutes. So yesterday we were talking about laboratory tests, mainly about the CBC, right? Also blood chemistry and some microbiological tests and some other tests. So could you tell me anything about this a CBC?
Is the complete blood count?
Okay, it's actually
And
blood is pronounced that way, blood. It doesn't matter if you have two continuous O's. It's blood, not blood. Okay, blood.
oh, okay. And it it counts the white blood cells and the white cells too, and the red cells. Uh, it does it too.
Okay, you told me two types of cells, right? The red blood cells and the white blood cells. And is there any other cells this CBC tells us about? There are actually three main types of cells. You
Uh,
already mentioned two. There's one left.
It does the white cells differential, I think, or the
Uh,
platelets too.
platelets. You know what platelets are, right?
Sorry, I didn't get it.
Okay. In CBC, we have three main types of cells that the CBC is going to tell us about, right? Red blood cells, you already said. White blood cells that you already said, right? And there's one last type of cells that you didn't tell me yet. Do you remember?
Mm, no, I don't think so.
Okay. You know there are platelets, right?
Mm-hmm.
Do you know what a platelet is?
They're not complete cells. They are just fragments of cytoplasm, I think, from
Of
a cell.
a bigger cell, right?
Yeah.
Okay, so yeah, those are help us with a formation of a clot, right?
Mhm.
Okay, so what could you tell me about? We already talked about um, red blood cells and white blood cells. Is there anything you would like to tell me about platelets? Normal ranges, maybe? Because you already told me they're like fragmented parts of a bigger cell, which is a megakaryocyte, right? So could you tell me the normal ranges of platelets?
I think it was 150 to 400.
And 50, yeah,
Mhm.
1,000, right?
Mhm.
Okay, great. So how would you call a lower count of platelets and a higher count of platelets?
Oh, now I can't remember.
In Spanish, maybe? Because they're similar words.
In Spanish is tro- trombocitosis.
Okay, the higher count, right? And the lower count?
Mm, thrombocytopenia should be.
Right. Awesome. So it's just the same in English, and we just changed the pronunciation. Thrombocytopenia, right? It's thrombocytosis. Okay. So in a patient who has anemia, okay, anemia, how would you expect to find platelets? Do you know?
The like platelets or the hemoglobin?
Okay, we have a patient who has anemia, and your CBC, your laboratory confirms that this patient has anemia. Okay, but how would you expect the platelets to be?
Maybe they have to be lower than the normal.
Okay, they are actually higher levels of platelets. When a patient has anemia, and I didn't tell you this, when a patient has anemia, they tend to have uh, thrombocytosis. Okay, so higher counts of platelets in a patient with anemia. Okay, so what could you tell me about blood chemistry?
Oh, sorry, I wanted to ask something.
Yeah,
The the reason of the thrombocytopenia is because the deficit of iron.
in well, related to anemia.
Yeah.
Okay, actually, it's the opposite. When a patient has anemia, tends to have higher counts of platelets. So this patient would develop thrombocytosis, no, not penia, cytosis. Okay, this patient would have thrombocytosis.
Oh, okay. And that's because of the iron deficit?
Not really. It is actually, well, it has an explanation when we talk about the bone marrow. When a patient has um, anemia, tends to produce more red blood cells, right? However, as you already said, there must be some specific cause for a lower count of red blood cells. However, the bone marrow actually tends to produce more cells to uh, to balance this decrease of red blood cells. The bone marrow produces more cells, but not only uh, red blood cells, but also all some other types of cells. In this case, would be platelets. So that is the explanation. Like the bone marrow is trying to produce more cells to balance the deficit of red blood cells. However, as you know, there's a lot of cells that are produced inside the bone marrow, and one of them is or are platelets, right? So when a patient has anemia, the bone marrow, if the bone marrow is healthy, then the numbers of platelets are going to be higher than normal. Because of this, it's like a reflex of the bone marrow to produce more cells. Okay.
Okay, now I get it.
Okay. So as we are talking about platelets, do you know where platelets are formed or produced?
The spin metal?
Sorry. Okay. The bone marrow. Bone marrow is medulla ósea, right? You wanted to say that, right?
Yes.
Okay, the bone marrow. Did you know that platelets are also formed in some other organ besides the bone marrow?
Oh, no, I don't think so.
There is actually an organ in which platelets are also produced. You didn't read about it?
No, I used to think that they were on blood produced on the blood.
The bone marrow, right? Actually, they're also produced in our lungs. Did you know that?
Not actually.
Okay, there are actually megakaryocytes, which are the bigger cells from which platelets are formed, right? So they found megakaryocytes in our lungs, and well, as a conclusion, uh, platelets are also formed in our lungs. Okay, so let's go on. We already talked about CBC. Let's go on with blood chemistry. What could you tell me about blood chemistry?
About the blood chemistry test?
Yes. What kind of parameters would you expect to have in a blood chemistry test?
Mm, uh, of each one, because I think that it just include electrolytes
Okay.
like sodium, potassium,
Okay, great. What else?
proteins too,
Okay.
glucose.
Okay, glucose. Awesome. And how would you call the concentration of glucose in in the blood?
Um, a glucose like hemoglobin.
How do you call the concentration of glucose in the blood? In Spanish would be glucemia, right? What
Mm,
about in English?
the same glucemia.
Glycemia.
I see. Okay.
Okay, with a Y. And okay, what else? You already said electrolytes. You told me sodium, potassium. Um, what else would you find in a blood chemistry test?
Enzymes.
Enzymes,
Mhm.
like what?
Mm, I, I don't know.
Okay, maybe not enzymes. We would have, for example, creatinine, right? Do you know where creatinine comes from?
I think they they come from the muscles.
Okay, in the muscles we have another. Actually, yes. However, it comes from a different molecule. Do you remember uh, what it was?
The nerves, I think.
Nerves. Uh,
Yes.
well, creatinine.
Yes, or am
Uh,
I wrong?
Creatinine actually comes from a bigger molecule, which is creatine. You might have seen people who go to the gym tend to have this supplies which says really big creatine. That is for muscle development. So muscles have inside of them they have creatine, and creatine turns into creatinine, and that is how we find it in the blood. However, inside the muscles we have creatine. So how would you expect to find a person's creatinine levels if has had a lower limb amputation?
uh, it should be higher than the normal because it has to produce more. Maybe more than one and five, I think.
Okay, a person who had who just had an amputation, you mean, right?
Yes.
Actually, our lower limbs, our thighs, legs, actually we use them much more than what we use our upper limbs. We use our lower limbs for walking, right? So we use them a lot more than the higher limbs. That is why we have more thicker muscles, bigger muscles in our lower limbs. So when a patient has had an amputation of one of his or her, let's say, legs, the creatinine levels are much lower than they used to be because there are a lot of more muscles in our lower limbs than our upper limbs. Okay.
Okay, so they should be less than 0.5, maybe.
Yes, they are really low because we get rid of a lot of muscles, and the creatine levels are lower, and for instance the creatinine levels are even lower. Okay, so patients who had an amputation of the lower limbs tend to have much lower creatinine levels than they used to before the amputation. Okay, that is an interesting fact. Okay, so Brisa, we are done with your 15 minutes, and since we are having this problem with the account, we're going to finish with you, okay?
Okay, it's fine.
Okay, um, I'm going to ask you all to join back for the survey.